So the role of FAO reference centers to assist laboratories operating particularly in resource-limited settings is to enhance their capacity to diagnose diseases and to conduct proper disease surveillance and disease control. To do this, the FAO reference centers need to establish long-term cooperation with these laboratories operating in these areas, assisting them in increasing their capacity in disease control, early warning, and surveillance.
I think regional support laboratories can provide support in short term, medium, and long term. In the short term, I think regional support laboratories can provide workforce development. In the medium term, I think there's a need to capacitate national laboratories to be able to respond to emergencies. In the long term, there will be a need to capacitate these laboratories and provide support to enable them share data and share knowledge with trust around what information is being provided, how the data is being shared, and what the ownership of the data is.
Often we're approached by laboratories who want our assistance to develop capability and capacity. But when we discuss what the local situation is, there's often a lack of power, water supply, a lack of electricity, a lack of equipment, and a lack of scientific resource to support diagnostic development. And so it's really for local governments to try and support some of these laboratories to try and enable us to increase the capacity building. It's critical that reference laboratories stay at the cutting edge of diagnostic development.
To collectively protect animal health and to expand our support to countries, I believe we really need to change our mindset and approach to these aspects, particularly in countries with limited resources. And the change of mindset is to consider having a laboratory and having access to diagnostic tests as a global public good.
So the labs are capacitated, they are able to provide this support at the regional level, both for awareness creation, for passive and active surveillance, and for research to continue to look at alternatives for antimicrobial use in food animals.
The last step, but not the least, is a good cooperation between international organizations. We need to work together to build our program together in order to be the most helpful as possible to our members, because our mission is really to be at the service of our members.